This is BoomerLife on CL 650.
Got to find a home, sweet home. Help me somebody.
And we're back. This is BoomerLife on CL 650. Joined in studio today from our friends at HomeCareAssistance, we have Carolina Arosa, President of HomeCareAssistance, and Jay Arosa, Partner and Director. So on today's show, we've been talking about a vision to change the world, change the way that the world ages. So caring for individuals that are dedicated to a holistic approach to home care, an approach to care that focuses on areas like nutrition, physical exercise, social interaction, which is essential for seniors, and mental stimulation. So we touched on this concept that baby boomers are now in the position of helping to try to meet the needs of their aging parents. And they think that when the parents finally decide to sell the house and move to an independent living residence, and we think that all their needs are going to be met. They're all looked after, sort of put them in a box, we get to walk away. But it's not necessarily true. There's a lot of specialized needs that independent living communities are just simply not set up to handle. And I know for a fact that this is where you can actually step in and provide some level of service. So let's talk about what you can do when seniors move out of the home.
Well, there are different types of services that we offer. So we have hourly service, so that can be from as little as 3 hours a day to as much as 24 hours a day, depending on how much monitoring and assistance the client needs.
So it could be very simple things like helping with medication.
Absolutely.
Or helping with chores around the house. Or
so anything from personal care, such as bathing and grooming, to medication reminders, meal preparation, laundry, light housekeeping, transportation to doctor's appointments, running errands like grocery shopping, and even companionship and stimulation. So we provide all of that with our hourly service, and then we also have our live-in service. So if your loved one needs sort of round-the-clock monitoring, someone in the home for your peace of mind as well, we provide that service where the caregiver can stay for as little as 1 day in the client's home to as much as 5 days. If need be, or even 7 days, there need to be 2 caregivers alternating at that point.
so that could be when they need just a little greater level of service. If myself as a child was worried my mom might fall in the night, or not take her medication on time,
or if there are no family members around, if they're living out of town or out of the country, they want that peace of mind that someone's there should their loved one need it. That's an ideal option as well. It's a very cost-effective option because you get that round-the-clock monitoring for a flat rate. And then we have overnight service as well. So that's a 12-hour shift where it could be anywhere from like 7 p.m. to 7 a.m., 8 p.m. to 8 a.m., whatever's convenient for the client, where if the client only needs, someone to, let's say help them with medication, getting ready for bed at night, may get up once or twice in the middle of the night to use the washroom, and then again in the morning to help them get started for the day. For those types of clients who have those kinds of needs, our overnight services is ideal.
I think this is probably a good time to remind our listeners as well that these services can be provided wherever your loved one is, whether it's in their home, in an assisted living home, or like you mentioned earlier, even in the hospital.
Absolutely.
So if I wanted, midnight till 6 care for a parent that was in the hospital,
we've provided that many times. So that's not something that is foreign to us. And again, the beauty of working with us or a home care agency is the flexibility and the number of options that you have at your disposal.
Well, it's actually, you bring up options. Let's talk a little bit about options that are available. I know a comment that we've heard many times from people is, well, the government will help me, and the government provides a level of home service that I'll just get looked after by the government. But you offer the private service, so how can you bridge that gap for us?
Yeah, absolutely. And we do get a number of questions about that as well. The government does provide some level of support, maybe not as much as they used to in the past, but there is some level of support. And a lot of times people think that they're going to be, the type of support or level of support that the government provides is going to be adequate. Many times we find it actually isn't. I mean, there's a lot of great workers and good services out there, but because the government is so stretched in terms of resources, there's very specific conditions and situations that clients or patients and their families have to meet in order to get certain type of care. And then when that care is provided, many times it's also very limited in terms of the number of visits they'll get per week or the number of hours they get per visit, and also down to the level of actual services. So to give you an example, there are situations where we get calls from clients that are receiving some public services, through their health authority, but they're not able, the person that comes in is not able to cook a meal for them from scratch, for instance, or to do some level of housekeeping, light housekeeping, or maybe to help a senior launder their clothes. These are all things that private services that we support are able to help out with. So in some cases, we're able to supplement clients that are receiving some level of public support. And in other cases, clients just decide, you know what, I'd rather have some consistency. I'd rather have one person coming in. So I'm just going to go with private services pretty much all the way.
Yes, and to build on that, I mean, I think that is one of the major reasons why people decide to go with private rather than with government. Because with government, unfortunately, because like Jay mentioned, they're stretched, it's a revolving door of caregivers that gets sent to the client. So whoever's available gets sent for anywhere as little as 45 minutes to maybe 3 hours, 4 hours at a time. And each time it's a different person. So it's extremely disruptive for the client because these new caregivers who are coming in each time don't know their routine, are not able to build a relationship with them. And for someone who has dementia, to have a revolving door of caregivers is extremely traumatic.
Yeah, I think we've established that consistency is very important as well.
It is very important. Plus, to add to that, if they go with the government, sometimes it's about 2 to 3 weeks before a case manager can even come out and assess the client for what their needs are to even provide the care. So if they've come home from the hospital, it's like 2-3 weeks later before a case manager is even able to come out and determine what their needs are and even provide that care. So again, with going with private agency, they have that flexibility of options, and also, again, the immediacy. We're there. We can be there as soon as in the hospital, even prior to discharge.
Somebody also has the choice of just hiring independently, hiring on their own.
Yeah.
And there's challenges involved with that as well.
Yeah.
Yeah, absolutely. I mean, that is definitely a choice. And a number of times we get asked from seniors or, their adult children calling in to ask about our services. What if we did hire someone privately? And while that is, definitely an option for them, we remind them that there's a whole amount of things that go behind finding the right person to take care of your parent that, you typically may not necessarily see or think of initially, such as screening and doing background checks and finding the right person that's qualified and has the right experience, but also the right attitude to do this type of work. And then beyond that, there's also making sure that, you're setting them up properly in terms of getting the right vacation pay, workers' compensation, et cetera, et cetera.
It's like hiring an employee.
Absolutely. It's a full-time thing.
Right. And you've already, at HomeCareAssistance, you've already done that background legwork to finding the right person, the educated person, the able person.
Absolutely.
The suitable person.
Sorry, I was just going to say, one of the things that we've actually found quite a bit is we'll get calls from clients that have hired caregivers privately, but because the caregiver has either fallen ill or has had to take vacation for long term, there's now no one to replace that person. So now, sort of what they do. And that's something that if you work with an agency, you typically won't find, because through our case managers, we're constantly monitoring to see when is someone taking vacation, is someone ill, can we replace that with an equally qualified person.
What about, I know you mentioned and you've spoken in great detail about your cognitive therapeutics and dealing with dementia and Alzheimer's. What about other illnesses or diseases, Parkinson's or cancer, or and where do you fit with palliative care?
Yeah, so like I mentioned, we have our very own Home Care Assistance University that has a plethora of courses. We have over 100 courses available there. And, they cover all the different aging conditions that the seniors face, even courses on caregiver etiquette, cooking courses. They even have courses on elder abuse and prevention and proper communication techniques. So you name it, we have those courses in Home Care Assistance. So whoever hires us can be assured that aside from the formal training that our caregivers come with, they get this ongoing education through the Home Care Assistance University. So we're well versed in being able to take care of any condition.
Well, we've covered a lot of information today, and I know if you're looking for some more answers, there's two ways that you can contact Home Care Assistance. One, please visit the website, homecareassistancevancouver.ca, and secondly, we can also give out the phone number again.
Yes, 778-279-3634.
279-3634. You're listening to Boomer Life on CL 650, and joining us in the studio from Home Care Assistance, we have Carolina Arosa, President from Home Care Assistance, and Jay Arosa, Partner and Director. Thank you both for being here today and your contributions.
Thank you so much.
Thank you.
And thanks to you for joining us today on Boomer Life on CL 650.